Case description. Mr. Wesley Brown is a 63-year-old male who was recently seen in the emergency room after being found down in the road by the police. Mr. Brown's wife reported strange behavior for the past 2 weeks. Paranoid behavior that consisted of him accusing her of an affair and seeing people in the walls. She also reported him sending paranoid emails about the justice system to his friends and showing his guns to the neighbors. Mr. Brown does not have a past psychiatric history and does not suffer from anxiety or depression. He has been taking cyclobenzaprine and morphine, MS-Contin, daily for years to manage his chronic back pain. Urine toxicology screen came back positive for benzodiazepines and tricyclics. Physical examination reveals heavy sedation, mydriasis, hypoactive bowel sounds, urinary retention, epistaxis, and depressed reflexes. CAT scan of the head and spine was performed, both negative. Alcohol screen and blood work were found to be within normal limits. CBC and CMP within normal limits. Electrocardiogram and cerebrospinal fluid from lumbar puncture normal. A mini mental examination was given to Mr. Brown. He scored 16 out of 30 points. Mental status examination revealed waxing and waning alertness, unkempt appearance, lack of cooperation with staff, slurred speech, and signs of psychomotor retardation. Affect alternating between subdued/somnolent and restless/agitated. Diagnosis: substance medication-induced psychotic disorder. Differential diagnosis: delirium, substance-induced neurocognitive disorder, substance intoxication and withdrawal, brief psychotic disorder. Rationale for diagnosis: benzodiazepines and opioids are known to cause drug-drug interactions, as well as opioids and muscle relaxants. Common side effects of benzodiazepines and opioids are drowsiness, confusion, impaired coordination, sedation, hallucination, and constipation. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-B, meeting the following criteria is necessary for diagnosis. The symptoms are not better explained by a psychotic disorder, schizophrenia, bipolar, etc., that is not medication-induced. Rationale for diagnosis: evidence from medical examination, lab results, and patient history that psychotic symptoms developed during substance use, or within 1 month of withdrawal from a substance known to cause psychotic symptoms. Presence of delusions and/or hallucination. Psychotic symptoms do not occur only during an episode of delirium. Symptoms are causing significant distress and/or impairment in one's daily life and ability to function. Rationale for diagnosis: drug-induced psychosis, also known as substance-induced psychotic disorder, is simply any psychotic episode that is related to the abuse of an intoxicant. This can occur from taking too much of a certain drug, having an adverse reaction after mixing substances, during withdrawal from a drug, or if the individual has underlying mental health issues. Signs and symptoms of psychosis are delusions, hallucinations, suspiciousness, and withdrawing from friends or family. Psychosis is merely a symptom, not a condition in and of itself. Treatment plan: 1 in 5 people with a history of psychosis will attempt to kill themselves. The cure to substance-induced psychosis is to stop using the drug or substance that induced the psychosis. Medically supervised detox can easily prevent the more severe symptoms of psychosis through the use of common medications. Common medications used for detox: antipsychotics or benzodiazepines to control aggressive behavior. Substance-induced psychosis in first episode programming discusses the importance of treatment and detoxification using 3 different treatment phases. First phase takes place in the ER where patient is monitored without use of antipsychotics. Second phase takes place outpatiently. This includes CO-located mental health and addiction interventions, termed integrated dual diagnosis treatment. Third long-term phase, which consists of family and group interventions, along with supported employment/education and safe housing. Ongoing support to prevent relapse. Substance abuse and psychosis. The strange case of opioids focuses on the correlation between opioids and other substances of abuse in developing or acting against psychosis. Several studies were conducted to study the prevalence of psychotic symptoms associated with opiates, covering a spectrum going from users with no diagnosis to those with severe dependence, ranging between 6.7% and 52.2%. No direct correlation between psychoses onsets in opiate users. Psychoses correlated with substance abuse, more common in cases involving cannabinoids, stimulants, hallucinogens, alcohol, and polyabuse. Acupuncture treatment of substance-induced psychosis, addiction, and pain. A review with case study discussed the benefits of introducing Chinese medicine to help aid in the treatment of patients with substance-induced psychosis. Acupuncture helped calm the psychotic patient and avoid psychiatry drugs. Reduce side effects of the psychiatry drugs taken by the patient. Reduce withdrawal symptoms.